Good morning, good afternoon, good evening, colleagues. We have colleagues joining us from across the world in this seminar on Intra-Action review. So as you probably have heard, but this coming Friday, we are having a very high-level press conference on Country COVID Intra-Action review, where the Director General will be hosting 4 ministers of health of 4 countries, which are Thailand, Indonesia, South Africa, and Uzbekistan. Those 4 countries have already and successfully conducted their Intra-Action reviews, and they will be invited to come online, to come live and share with the world what they've been doing as far as the Intra-Action review is concerned, and implementing the recommendations coming from the Intra-Action review to improve the ongoing response to the COVID-19. So this is like a prelude to that press conference that will happen on Friday at 11 a.m. Geneva time. Next. So what is an Intra-Action review? First of all, I'd like to give you a little bit of background. The Intra-Action review that we are proposing has been modeled after action reviews, which is already a practice that WHO has been promoting for the past 4 years or less under what we call the IAR monitoring and evaluation framework. So we use the after action review methodology, and we modeled and came up with this approach we call Intra-Action review. The main difference is that this one is conducted during their response for course correction and improving the response as we are moving along. But the after action review will be conducted at the end. So an Intra-Action review, as I said, is a country-led facilitated discussion where national and subnational stakeholders come together to reflect, to provide their personal individual perceptions, to try to reach a consensus through what we call a collective perception on the ongoing COVID outbreak response at a country level in a bid to identify the best practices. You know, countries have been responding to the COVID-19 for the past 8 months. A lot has been going on. So this is one of the, this is the critical time. And I believe many countries have been doing that already, to sit down and to reflect on what has been going on in a bid to identify the best practices, the gaps, and the critical areas for improvement. To propose corrective measures and actions for immediate implementation so that we can improve and strengthen the COVID response, both at the national and the subnational level. But also the Intra-Action review can help while applying the recommendations to support the response to concurrent emergencies that are happening also at the country level. Next. So before next, I'd like to show this on the right side of this slide. As you can see, we have put a map of some of the key features of the Intra-Action review in terms of tools and activities that we are doing. So there have been a lot of webinars trying to engage the regional offices and countries. We've conducted some orientations with countries. It's more of a country-led. It's countries sitting down, reflecting on their own COVID response to improve that response. So the methodology and the tools that we're proposing here are very flexible. I'll come back to that. It's multi-sectoral, and we encourage countries to share their success stories. Carrie mentioned about it, the best practices, because we need to learn and to know what is working for other countries also to learn and apply those lessons learned and best practices if that are working well in one country. Next. Yeah, so this is like some of the principles regarding a country COVID Intra-Action review. It has to be participative. We always encourage to have the right people in the room, people who have been involved in the response, because they have access to the details. They have more information as to what happened. We need to engage them in an open and honest discussion so that they can share their pains, the things that worked, and the things that can be institutionalized and improved. It is space for experience sharing. Here, an Intra-Action review gives an opportunity for tacit knowledge sharing. This is an opportunity to learn and to see what is going as far as the response is concerned, and with a fresh memory of the details, and people can learn from each other. It's all about analyzing the systems and processes. Here, we're not trying to name or to shame and blame individuals. We're not trying to evaluate individuals, but looking at the critical interventions and critical actions that were undertaken during the response and how those interventions have appeared to be a success or less of a success, and how can we improve moving forward. It's all about identifying solutions, and we always focus during those interaction reviews to focus on the solutions, how we can move on. And also, as I mentioned, it's all about individual perceptions that are brought together to reach what we call a collective perception of the response. Next. So, as I said, it's more about an opportunity to share tacit experiences of individuals and to collectively analyze the ongoing COVID response. We always emphasize on reaching a consensus. That's why I talked about a collective perception. People have to bring together their own experience, the things that they believe can help to improve the response moving on, and also to see the things that are working, how they can be institutionalized and sustained in the response moving forward, and also preparedness for COVID-19 and other emergencies. It's an opportunity also to document and apply those lessons learned. So that element of documenting, because we don't want to forget or to lose track of the good things that have been happening. When they are documented, it makes it easier for being implemented when we have recurrence of the disease or the emergency, but also when they're documented, it's easy for other countries or for other generation to learn and be able to apply them in the future. And also the IAR provide a basis to validate and update the country COVID-19 strategic plan. As you know, all countries, as of today, many countries, actually most of the countries, if not all, have a plan for COVID response at the national level. So IAR can be an opportunity to validate what is working as far as that plan is concerned and what can be changed inside the plan. Over. And next. All right, so here, as you can see, we can have interaction reviews at the national level and also at the subnational level, but all those interaction reviews being conducted either at the national or subnational levels, all of them feed into the ongoing national and subnational COVID response. And as you can see, at the end, when the COVID-19 outbreak at country levels will be under control or declared over, there will be an opportunity to conduct what we call an after-action review, as recommended under the International Health Regulation, Monitoring and Evaluation Framework. When the after-action review will be conducted for COVID-19, all the intra-action review findings will feed into the after-action review for long-term preparedness and response to future emergencies and future pandemics. Next. Here, we are proposing a scope. The scope is very critical when planning to an intra-action review. But also, please note that once we have decided the period to review, let's say for now, we've been for the past 8 months under the response to COVID-19 at the country level. So we can consider the 8 months as a period to review. And once we decide on the period, we decide which are the critical pillars or functions we are going to review. As you know, the response at all countries is already structured into different pillars. So we can decide which pillar we are going to review. We can review all the pillars depending on how much time we want to spend on the interaction review. But remember, interaction review is not now a priority for countries. The priority is the response to COVID-19. So it shouldn't take a lot of time and it shouldn't distract the current priority, which is the response to COVID-19. However, some countries, like so far, some have been able to do a comprehensive interaction review with many pillars, and some, like in Namibia, they've done different IARs, but some of them were just for 4 pillars and others for 5 pillars or 3 pillars. So it depends on each country. You can do an interaction review for a single pillar, or you can do it for multiple pillars. We want it to be as, in terms of participation, as few people as possible, especially within those pillars under reviews, so that we can have a smooth flow and smooth conversation, and people are more than willing and able to share, because everybody's perception is critical and is needed during an interaction review. But now, as you know, because of the COVID-19 conditions and situations, we cannot do it. I mean, we can do it on site, but we have to respect social distancing and other recommendations that are there to avoid transmission and dissemination of the virus. However, now we are using online tools that exist already, including Zoom, Microsoft Teams, and many countries so far have been conducting it online, but also you can do it on site. But you have to really make sure that you respect the policy and the measures that are applicable in the country for to avoid transmission of COVID. And also here you can see for the period, it can take half a day if you're doing just one pillar. It's going to go up to 2 days. Some countries did it for 4 days, like Thailand, they did it for 4 days. Indonesia also. So it depends on each country, on the pillars you want to do. So once you have decided on the period and the pillar that you want to review, this will help you to decide on which format and how you are going to organize yourself, if you can do it online or on site, or if you can do both. This will help you to decide on how much time it will take. This will help you to select the right participant, the people who are going to participate in that review. And we always encourage people who have been involved in the response of that pillar under review, because those are the people who have the information as far as the details are concerned for the response in that specific pillar. And also there is this one very critical element of an interaction review, what we call trigger questions. So once you have decided on the scope and on the pillar, you will know the kind of questions or the kind of trigger questions you can use. We'll come back to that next. Next. So here, again, those are some of the possible pillars that you can consider. Here, those are the pillars that that are in the country, in the WHO COVID Strategic Preparedness and Response Plan, SPRP. So as you know, we have the country level coordination, risk communication, and all that. And you will also notice, even at the country level, most of the times, the response also is structured as per those pillars to some extent. So this is just indicative, just to show you the kind of pillars you can consider when structuring or when putting in place your interaction review at the country level. But one thing to note here, as you can see the last one, the 10th one, we called it other possible topics and cross-cutting issues, because here, for instance, we have proposed like some questions for vulnerable populations, or COVID-19 being conducted within some vulnerable settings, within refugee camps, within prisons. And so those are some of the cross-cutting issues and the topics that are not necessarily covered under the SPRP per se, but that can be also critical in an interaction review and considered as a standalone pillar for review under an interaction review. Next. So here, when do you conduct an interaction review? This question has been asked to us several times. When do you conduct? What are the possible situations that can push you, that can encourage you, or that can be the basis for conducting an interaction review? So those are some of the considerations that we are proposing. They're not exhaustive, but we're just proposing some of the critical and possible situations that you can consider for conducting an interaction review. You can conduct an interaction review when, for instance, you have a significant number of reported cases. So something is happening, you want to know what is happening, and to be able to document, to understand the root causes, the factors underlying the factors that justify, that explain that increase or that decrease. So an interaction review can be conducted. You can do it just to review a specific program or intervention that is appealing to you, or whether you have noticed some failures and you want to do an interaction review for that specific program, you can do it. You can do it to review the national supply chain. As you know, it's one of the critical interventions happening in countries now, with supplying, the testing kits and the IPC equipment, tools, laboratory equipment. And so this is something that you can consider conducting an interaction review for, to see what are the bottlenecks and understand how those bottlenecks can be overcome, and what's going well already, so that it's protected in the future. As you know, we are now moving into a second wave for most countries, so you are able to protect those best practices and so that we don't lose them. It's going to be a demand from industry, from civil society, and from community, just to look at how the response at the country level is effective or not. Next, please. It can be just to look at this social economic impact of the COVID at the country level. It can be just a matter of identifying some critical areas for further research. As you know, there is a lot of unknowns for COVID-19. It can be just to obtain consensus about some topics of public health concern, but also it can just be a matter of review of adjusting public health and social measures during the COVID response. So all of them are just possible situations that can trigger, that can be a basis for conducting an intra-action review at the country level. Next. So here, it's a roadmap. I'm not going to spend a lot of time here. It's just to take you through the IAR process and what we encourage countries to do before, during, and after. I would like just to highlight some critical points there in that table. For the pre-IAR, it's always good to decide on the scope. I mentioned about the scope. It's very, very critical to know what you are going to review, what are the pillars you're going to review, because this will help you to decide on the format, to decide on the team, to put in place a team, how much it will cost you, and the rest, and to know the key stakeholders that will be invited. So it's very important that ahead of time, the scope is clear, defined, and decided upon before you can start the preparation part, which is you do some desk reviews, some literature review to understand, to have some sort of a baseline to understand the current response situation at the country level, and also to be able to finalize and formulate the trigger questions, the key questions that need to be responded during the interaction review. Because it's always good to go there in the interaction review knowing or at least being clear of some of the critical questions, like a threshold of questions that need to be discussed upon, so that before we can open up and for people to share and build on those questions. So it's very good to decide this before. And then during the interaction review, as I will come back to this about the steps that you will consider. I've also mentioned about building consensus. I talked about the collective perception of the response. It's very, very important because that's how it helps to build the ownership. Because even the recommendations, when they come or they emerge from that collective perceptions, there is ownership in the implementation. So it's very critical. That's why we mentioned, talk about this, the consensus. And then maybe I will talk a little bit on the follow-up. I talked about documenting. Follow-up is very critical because we don't just want countries to conduct the interaction review, identify critical areas for improvement, come up with a very nice report, and then there is not follow-up to make sure that those recommendations are actually being implemented. So more and more, we are focusing on that post-IAR to work with countries, or for countries to really plan how they are going to make sure that those recommendations, especially the quick wins, what we call the low-hanging fruit, those that don't require a lot of money, so that immediately after the interaction review, there is a drive to make sure that what needs to be fixed is fixed immediately. Because as I mentioned in the previous slide, it's all about feeding into the ongoing response. So if there is any action which is immediate, we don't have to waste time. So there must be a sort of a follow-up mechanism and strategy and roadmap that is decided upon to make sure that the implementation of recommendations actually happen. Also, I talked about the lessons learned and success stories for other countries to learn from what's working in one country or the other. Next. So here I'll be spend a little time here so that you see how the interaction review is structured. So as I mentioned, we have the scope, we have the team, we invite the right people. We have decided on the trigger questions. We have decided on the pillar we're going to review. So what happens during the interaction review? So the 3 steps, those are the steps that we critically look at. This is like the most important part of this whole process. We need to know, first of all, to have an understanding, to have a baseline understanding for everybody in the room before the discussions, in understanding what was there before COVID-19 in terms of capacities. What are the new capacities that have been developed? What is the current response strategy? What are the key milestones of the response for each of the pillar under review? Once that baseline is established, we have a common ground, a common understanding of the response, of how it's going at the country level. Then we can move on to the next stage, which is the most critical one, which is for each of the pillar. And based on those trigger questions, we want to understand what worked well, what works well, and why. The why is the most important part here, because it's not about just doing identifying symptoms. No, it's about identifying the etiology, the underlying factors, the reasons, the root causes of each of the successes and the failures. So those are some of the tools that we can use. We mainly propose, most of the time we use, which is like straightforward, the 5 whys. Sorry, it's 5 whys, not 5 WH, to help us conduct the root cause analysis. The idea here is to go deeper. It's a deep dive behind every success, behind every failure or challenge or bottleneck that has been identified. Conduct a deep dive through that series of whys to go deeper to understand what are the underlying factors that make it a success. What are the underlying factors that make it a failure? Those underlying, they can be enabling factors or contributing factors. There are other tools that exist outside that we can use that are available that we sometimes do. We can use the problem tree analysis. We can do this one called the failure mode or effect analysis. This one is mostly used by airline companies. When a plane crashes, automatically they conduct a failure mode and effect analysis to understand why and what is the cause that must have been the cause. And so this is a good methodology that can be used. The idea here is to do that root cause analysis, to go deeper in understanding why this is considered as a failure or why this is considered as a success, and how before you can move to the step, how can we improve it next, how can we improve it moving forward, which is step 2. What can we do to improve next time? Here, after you have identified the causes, as I told you, it's not about the symptoms, but it's about the etiology. It's about the root causes behind those symptoms. Once you have identified them, it's become easier to make, in quotes, a prescription, and which the actions can you take? Which are the recommendations you're going to propose to solve that problem? If it's a problem, or to institutionalize, or to protect, or to make sure that best practice is not lost. But once after you've done it, you have to prioritize them, because you can end up with 50 and plus recommendations. We need to prioritize them. So we can use what we call a criteria rating matrix that we propose, looking at the feasibility and the impact on the COVID response, or we can also use the cost-benefit analysis. Those are some of the tools you can use, but also, of course, we look at the political willing and all that, and the availability of resources and all that. So this is part of that feasibility. So, and then the way forward. The way forward, as I said, is very critical. How do we move on once we have those recommendations? How do we implement them? How do we make sure that the resources are available? And how do we document the progress? How do we make sure that we are really taking action after the intra-action review? So this must be also decided during the intra-action review. Next. So WHO, we have proposed tools, guidance and tools that countries may use. It's very flexible, the tools. You just adapt them to your context and to the situation in the country. The tools have been published now in 7 languages: English, Chinese, French, Spanish, Arabic, Russian, and Portuguese. They're already available online. As you can see, the link is there. Next. So I'd like just to focus a little bit on this one. Just 1 minute. I don't know, Carrie, how much time do I still have?
So Landry, we've been going for about a half hour now. So yeah, okay. It would be good if we could leave some time for questions. But yeah, go over the final key points.
Definitely. So let me. This slide. As you can see, the trigger question is as we have around 300 trigger questions that we have proposed. The idea is not for countries to answer them as a Q&A, but it's just to help to structure, it helps to elicit, it helps to establish a baseline, a threshold for the discussion. And before people start opening up and sharing what they know and what they've gone through and what they've noticed of the response. So as you can see, we have around 300 trigger questions for the 9 pillars as SPRP, but I leave it for you at your leisure to please look. Next. Yeah, so again, this is another success story. We talked about sharing. So there is a success story template that we are proposing also in the tools. Next. Yeah, what makes an interaction review successful? I'll be very fast here. I talked about the scope. Once the scope is decided, it's clear, you know what you are going to review, what are the pillars you're going to review, what are the key critical questions you're going to answer to, and who are the stakeholders you're going to invite. It will become very easy. I talked about the ownership and also involving everybody that has been in the response, but also using the whole of society approach, that making sure that everybody, partners, government institutions, and even the community, when necessary, if you can involve them in the process, that is very helpful. I talked about the follow-up, which is very critical. And this IAR must or should be conducted as a continuous learning and management tool. And also, as I said about thinking, looking at systems, looking at processes, it's more about the system thinking and how those systems work together and all those pillars work together. It's not about reviewing individuals or evaluating individuals. Next. So, okay, we have here the partners platform that you can use the interaction review outcomes to update your partners platform profile. That's all I can say here. Next. So you probably have heard about the 4th meeting of the IHR Emergency Committee, which took place on the 31st July. So one of the recommendations to WHO Secretariat was to continue to distill and rapidly communicate lessons learned and best practices from the COVID pandemic and national interaction reviews. And also to member states or to countries, they recommended to share best practices, including from interaction reviews. So just to show you that the interaction review practice align with what the emergency committee also proposed. Next. So we published a commentary in the Lancet just to demonstrate the necessity for conducting an interaction review and how it can help for countries to change the trajectory of the epidemic and minimize morbidity and mortality at the country level as far as COVID is concerned, if the recommendations are being applied and implemented and fed into the ongoing COVID response. Next. So just to finish, before I finish quickly, we have around 21 countries that have implemented intra-action reviews, mainly in Africa. in the Afro region since the launch of these tools. So those are the countries that have used the tools that we are talking about here. And maybe to finish, we have an online course that we'll be publishing very soon. And I will finish by inviting all of you this coming Friday at 11 a.m. There will be a very high-level press conference convened by the Director General, Dr. Tedros, and with 4 honorable ministers from 4 countries. I mentioned them at the beginning. So please come. They will be sharing their experience in conducting the interaction review and how it has helped the ongoing COVID response at a country level. So thank you for your attention. Sorry, I've taken long. Over.
Hey, Landry, thank you very much. I think that was very interesting. And a couple questions came in as if asking if we'll share the slides. And of course we will. I can share them on Workplace afterward. And Landry, I think we have some external participants as well. So
yeah,
perhaps we can email them around. So yes, of course we can share this. Let me stop sharing my screen. Okay. And I'm going to pull up the questions. We've had a couple come in. Hang on, let me get to the right screen again, where the questions are. Okay. Okay, so some of the questions, Landry, you may have covered in your presentation, but I think it's good to ask them again, you know, as they come up, just so you can reiterate or take a different angle to what some people might be asking. So, so why don't I just start? First off, I'm wondering how many people are on your team that help you to do this, and it segues into this question of it's talking about specifically slide number 6. It mentions 10 to 20 participants. So who are they? Are they staff? Are they partners, etc.? And how does WHO choose who goes to which country?
I answer now.
Yeah, do you want to, yeah, we'll just go one by one, and then I'll see if
definitely.
People want to raise their hand as well.
Yeah, thank you so much. So we are a small team here at HQ level. We are only 5. And we are working, of course, to increase. There are some discussions, ongoing discussion to increase the number of people working on interaction review at the HQ level. But we are 5 as of now, and but we have colleagues at in the regional level who act as focal point for interaction review, who help and support countries directly in implementing interaction reviews. So we have colleagues in in Africa, in Asia, and I mean in all the WHO regional offices. We have colleagues. Each region has at least one person working on this line of work. But of course, we have, as I said, it's a country-led process. So we only support. We don't conduct the interaction review for countries. We only provide the support, and most of the support that we do is to avail the tools with them, take them through the orientation and training. We talked about the online training. Sometimes we do face-to-face training. Sometimes we also go in the country and do a training before themselves they conduct the interaction review. So the facilitators, each pillar has 1 to 2 facilitators. Those are nationals, because it's all about sharing the experience, and it's all about, and people share more where they're in the settings where they're talking to someone they know, they've been working with during the response, someone they know already in the country level, in the country, someone who's respectful, so it helps, and someone who has facilitation skills. So that's how people really open up. So we provide a training of facilitations. We are sometimes part of the IAR, but not taking the leading role. We let the leading role to the IAR team that is constituted at the country level, but we make sure that that IAR team is equipped, is trained, and understand the process, and we are there on the background to support them as needed. Who is invited in the room? 20. We talked about 20. I talked about all of society, but it's more about all stakeholders in that country that have been involved in the response for that specific pillar. If we are reviewing coordination, all the partners that were more involved in the coordination for COVID as a pillar It's good they are part of that discussion role. If you're talking about IPC, or I mean infection prevention and control, sorry. So it's good all the partners at the country level, all the government institutions working directly on IPC, they are part of that IPC pillar discussion. So the same for case management, the same for logistics and all that. So we have separated, structured discussions ongoing in parallel, and then we have a cross-fertilization. We bring them together to identify the cross-cutting issues for each of the pillars, and giving also a chance for other people to contribute to other pillars as far as their observations and all that. So this is how in real world it works. Yeah.
Okay, so really these are, is it correct to say these are country-led initiatives that WHO supports and facilitates? Yes. Oh, cool. Okay, great. And then kind of on the training note, so you had mentioned that there's going to be, or there is an IAR online course. Is that going to be part of the WHO Academy eventually, do you think? Or right now, how is that being run?
So it will be on the on Open WHO platform.
Okay.
Yes, so that's where all the COVID-19 courses nowadays are. And so where, I don't know where the Open I mean, it will of course end up in the WHO Academy, but for now, it will be on the Open WHO platform, and it's going to be in English, French, I mean, all the 6 UN languages in WHO, and we are planning even to go beyond for countries with big sized population like Indonesia. So we are planning to have the language, I mean, the course in the language spoken in Indonesia, in Hindi, and the rest. So this is the plan. Yeah. Okay,
great. So I'm just looking at the chat, and I see that, so someone said they're having trouble accessing the Slido, but has a question here. I want to ask, do you want to raise your hand and ask it live?
Yeah.
So it's Ingmund, and that might be combining your last name as well. Instead of me reading it, do you just want to ask your question? No, I don't see hands going up. Okay, all right, let me read the question, but if anyone wants to raise their hand and talk, take the floor to ask your question and have a discussion with Landry, please do so. Okay, so here's the question from the chat. So it says, what are the key differences you would expect for conducting an intra-action review for subnational level?
So first of all, yeah.
Okay, go ahead. Go ahead. No, go ahead. I was going to read it again. Go ahead.
Yeah. So, okay. The response at the country level, I mean, each region or each subnational level, let me put it that way, they may have some specificity, some peculiarities as far as the response is concerned. So some of the challenges they are facing may not be the one that are being faced in another region. So having it's some sort of a focus group IAR, a focused IAR just to that region, can help to maximize on the learning, because they'll have enough time and talk only on that problem in that specific region. When enough time, elaborate discussions, they'll be able. It helps to maximize the learning and improvement. But again, as I said, all of it goes back into the national level response, because whatever lessons or whatever success stories happening in one region, another region, by region I'm talking subnational level, another region may also benefit from that. So that's what I can say about it.
Okay, thank you. And then, so I have two questions that have come in from Salawu. So one is a statement saying you should bring in UNV to support the team.
UNV.
So I don't know what UNV stands for, but additionally,
United Voluntary Program. UN Voluntary
Program.
Okay,
UNV. Okay. Yeah. Okay. And then tagging on to that, the question is: are all countries conducting the IAR effectively there to support the response? And if it's conducted poorly, what can WHO do?
Yes, our responsibility, first of all, is to provide the support, the advice, the guidance, the tools, and the trainings when needed, and the supervision when needed for a quality intra-action review. And but at the end of the day, it's the responsibility of the country to take ownership of the process and drive the implementation of recommendations. WHO can facilitate. WHO can connect with other partners. Can identify partners that can help to, if a capacity need to be built in one area or the other, WHO can provide that support. But again, it's that's why an IAR must be very carefully prepared and organized, involving the senior management. The senior level officials at the country level should be aware of it, should be informed about it, and also they should be involved, I mean, from all throughout all the process, so that whatever comes out of it, they're able to drive it to make sure that partners can support in implementing them. So this is the only way to guarantee the quality. It's more about that follow-up, the ownership, and how we are driving the implementation of those recommendations.
Okay. And the follow-up question from someone else along these lines is, who can endorse the IAR report? So who like, I mean, so we were just talking about what if it's conducted poorly, but who endorses it? Is it the member states, the senior management that you're talking about, who endorse it?
Yes, so I mentioned about 21 countries that have conducted, and only a few have shared with us the report. So the way it goes is, of course, it's a country-led process. It's a country-led exercise, and it's a country-owned activity. So whatever they are willing to share has to be cleared at the country level by the competent authorities. So, I mean, I don't know. That's for the country to decide who has to clear it. Is it Minister of Health? It can be Prime Minister Office. It depends on each country. But whatever the report is availed before they can share it publicly. You know, I mentioned about success stories, and some of the information can be also critical, sensitive. So it has to go through a clearance process at a country level. And when the competent authority at the country level clears it, then they share it with us. It's not WHO. It's at the country level.
Okay. Okay, great, thanks. So a couple more. Let's see. So, okay, so with these, so how will these intra-action reviews weave into the after-action review for the COVID-19 response as a whole? So I know that work is ongoing now to look at, you know, the response of the world essentially. How did these fit into that report?
Yeah, that's why. Okay, the focus, the first focus, or the first priority of an interaction review is to improve the ongoing response. So this is our first target point. The second one, I talked about documenting, because whatever is identified as a challenge, whatever is identified as a success, if it's properly documented, and this will not be lost, because we don't know how long we are going to be on this COVID-19 response. So we don't know how long. So and then, you know, the fresh memory is very critical in IARs, because we want we want the details. It's only when we understand the details, then we will be able to identify the root causes.
Yeah.
Because if we don't remember the details, it will be very hard to pinpoint and understand those root causes underlying those successes or those failures. So we don't know how long COVID will take. So the IAR we do, if we document them, we'll have enough information of what has been going well, what has been going less well. So it will be easy when we come to the AAR for more long-term preparedness planning, for more long-term health system strengthening, thinking long-term. This will help. But now the priority is the ongoing response. How can we stop COVID, and how can IAR help in the process?
Okay, great. Does any of the participants, do you want to raise your hand and ask your question directly? I keep looking at the list for a hand to go up. But I can keep asking the questions in Slido. That's fine. But if someone wants to take the floor, please don't hesitate. Okay, so Landry, so there's another question. This goes back to the work of the country. So are there special TORs for the national working group who's assigned to oversee conducting the IAR? So terms of reference. So the people who are running these, do they have terms of reference, and do we assist in that at all?
Yes, we do. When you go in the package online, so it's very easy to find when you just Google COVID-19 Intra-Action Review, WHO COVID-19 Intra-Action Review, to take you directly to the page where you have published all the tools, and you will see there's the guidance which kind of provides the overall strategy and the definition and process, and then you have the tools that we are proposing, including even a concept note.
You're frozen. There we go. You're back.
Yeah.
Okay.
Yeah. So when you go through those tools, and you will see we have everything that is there. And then again, the idea is we're just providing something, but it's not like cast on stone. We're encouraging countries to take ownership of that, adapt it, remove what they don't want, remove what fits the context, what fits the need, and then make it, make it aligned with the current, the country priorities and all that. So this is what we are proposing, and everything is online, but it's for the country to adapt it accordingly. And of course, we are there to provide support if needed through our colleagues in the regions. Okay.
And so relating to this, so a question came in on this. So do you recommend external facilitation of these discussions, or is it all done in country? So, I mean.
So it depends on each country and on how they want the IAR to be objective. But this is not mandatory. It's not mandatory because, as I said, the idea, it's more of a self-reflection. It's the country, doing some introspection, looking at what has been going on for the past 8 months. What are the critical bottlenecks? What are the key success stories? And what can we protect as successes? What can we, But if the country wishes, and we leave it at the discretion of the country, to have some external facilitators, it's very much possible, and we can provide also support in that regard, making sure that the facilitators also are, at least if they choose to use this methodology, we'll make sure that we equip them, and we are at par. We are at the same level of understanding and what we are targeting, and so that we have something that is feasible and that the country can use. Yeah.
Okay. Yeah, there's another question around this as well, saying, when considering good practices, does the IAR team also bring insights of best practices elsewhere? An outward perspective seems necessary to be able to refine current response actions. So kind of going along those lines about having third party.
Yeah. Yes, we are conducting webinars, and the idea also is to invite countries, like what's happening actually on Friday. I really invite all of you to please tune in and to the DG press conference on Intra-Action Review. So 4 ministers will come live to share how they did the Intra-Action Review and how it has helped the country in responding to the COVID, and in improving processes, in improving some of the key interventions and all that. So I invite you to please join. And this is some of the things that we're encouraging, and there will be more and more webinars and platforms. But the other one also is when you share the report, you can share all the reports, you can share part of the report, you can just share a success story. It can be a 2-page success story of what's going on well at the country level, and you want to share with the rest of the world. We can help to amplify it at our level so that the rest of the world sees it. So this is also another way we help to share the best practices, across boards for other countries, for other regions, to see what's going on and all that. So yeah, we can do this, and we have also a website Thank you so much, Candice, for putting the links. Can you also put the link for the strategic partnership platform that we also publish the reports that we have for countries who are willing to share?
Is that the COVID-19 Partners platform where these are presented, or the SPRP platform?
No, it's the SPH, the Strategic Partnership for Health Security platform, which has been here for quite a while, which helps which is very strong platform, bringing together all stakeholders and multinational partners on that platform in understanding, or in bringing together, in trying to crowdsource all the resources in terms of skills, money, technical skills for health security globally. So we have a page there where we populate and we put the reports, and we have not started for intra-action review, but we have for after action review. We have a page there, but very soon we'll be putting also for intra-action review.
Okay, great. Well, thanks, Landry. This has been really interesting. We've gone through most of the questions up on the Slido, and I will send them to you so you have them for your reference. Just to repeat again, we'll have this recorded up on Workplace. We'll put the slides up there so people can access them. And everyone tune in at 11 on Friday. It's 11 o'clock, right, Landy? On Friday? Okay.
Yeah,
so
11 o'clock Geneva time. Yep.
Okay. That sounds great. We'll tune in then. We broadcast or stream the press conferences on the WHO website, so people can find it at who.int on Friday when we stream the presser. Okay. Well, thanks so much. I appreciate it, and I hope everyone has a nice day.